I'm just a boy from Kansas out to save the world from chronic disease. And I truly mean that. Nobody is in control of your health but you. I can't heal you. Your doctor can't heal you. You have to heal you. And it's all about having the education and empowerment to know what you need to be changing within yourself, within your life, to set your soul free and accomplish that best life that we all like to talk about. And I truly believe that the greatest medicine of all is to teach people how not to need it. I'm Brendan Vermeyer, the original Holistic Savage. Welcome to the Holistic Savage podcast. All right, we are finally live. So welcome to the Holistic Savage podcast. I am Brendan Vermeyer, the original Holistic Savage. I am super excited to have my good friend, Dr. Carrie Jones, on today. Carrie, you look amazing. How are you, my friend?
I am great, and I'm great because look, I have my Holistic Savage T-shirt on. So
you sure do.
I'm representing today.
They're soft, right? You know, they're cozy.
What'd you say?
They're soft shirts. They're nice and cozy, yeah?
They're really nice. Yeah, you did a really good job. Yeah, nice job.
My team did a good job.
Nice job, team. Nice job, Brendan's team.
Yeah,
for sure.
They do good. They work hard. Well, I'm super excited. So the Holistic Savage podcast, I was typing up a nice description for what is this podcast all about, but ultimately, it's all about everything related to holistic health, specifically functional medicine, functional fitness, functional spirituality, functional psychology. You know, anybody that's in kind of the holistic, functional, integrative world, we know it takes all the above. So, you know, today's episode probably going to be more so along the lines of functional medicine, but it's always fun to have just these free-flowing organic conversations. We'll see where it goes. We might talk about rubbing crystals on her head. But Dr. Jones, Carrie, where do we even begin? There's so much. So you are, you know, I'll be posting your formal bio so everybody can see, you know, what that exactly looks like. But obviously, doctor of naturopathic medicine, you're the medical director for Precision Analytical, makers of the Dutch test. So I'd love to just kind of kickstart, and we'll kind of back up almost like interview style of like, okay, when did hormones, like you are the queen of hormones. I feel like you've established yourself as the hormone queen. So when did hormones really come into your life as like your jam? You know what I mean?
Right. You know, it's funny. So I tell people all the time, I've known I wanted to be a women's health doctor since I was a little kid. I knew I wanted to be a gynecologist. I thought I wanted to be a pediatrician or an OBGYN and go into women's health since like the dawn of day. I took a little side turn. I thought I was going to be a marine biologist, and I lived in the Florida Keys for a couple months. Worked at a dolphin research center and a shark lab down there. Loved it. Decided that in like marine life was more fun on vacation, not so much what I wanted to do. And so I switched back into medicine, and I was on the conventional track to go to conventional allopathic medical school. And I realized that form was not for me. That's not what really filled my heart. I was volunteering at a hospital that did a lot of community outreach for prevention medicine. Now, it was their form of prevention, but still it was my introduction. It was blood pressure lowering prevention, weight loss prevention, diabetes prevention. And we would go out in the community and take blood pressure checks and blood sugar checks, and we would talk about exercise. And I loved it. It was very fulfilling to me. Moved to Oregon on a whim, believe it or not. And this month of recording, July, is my 20th year out in the Northwest. So I'm not a Northwesterner Pacific Northwesterner by birth, but I figure 20 years puts me pretty close.
Yeah, you're pretty
And then I found the naturopathic school out here, and I was like, oh, this is it. And I chose women's health and gynecology, and that's what I studied. And I did my 2-year residency in women's health and gynecology. And you know, when you just find what you're good at and it just clicks, you know, some people are good at fixing cars. Some people are good at coding on the computer. You know, some people are good at teaching kids. I am not good at any of those things, but I am good at hormones. And so I just stuck with it. And that's what I tell people that I do. And it's great because I know about other stuff, and I just refer out when it doesn't fit in my wheelhouse, you know, when somebody comes in with joint pain or somebody comes in needing something neurological, like cardiovascular, I just refer out for that. But hormone stuff is what I get.
It's your jam.
It's my jam. It's my jam. Yep, for sure.
I
So
love that. You
yeah.
know, I actually once upon a time, probably back in like fourth, fifth grade, I wanted to be a marine biologist. That was, you know, my childhood thing, because I love sharks. They're like my favorite animal, and I love scuba diving and all that. And I created I remember I did a report one time on Jacques Cousteau, you know,
Oh
famous
yeah.
marine biologist dude. I'm not sure when that all went away and somehow, but here we are, you know,
Yep.
having this conversation
Right.
years
Still
later.
just as good. Still just as good. Yeah.
Absolutely. So you went to, was it Bastyr or what was this?
No, I went to the school in Portland. So at the time, it was the National College of Naturopathic Medicine,
Mhm.
and it is now the National University of Natural Medicine. So
Very
I got
good.
my ND there. And then I went on, I decided I wanted to do a lot more international women's work. So I got my master's in public health,
Oh, wow.
with a focus on sort of international work. I was thinking at the time that I would do a lot more with NGOs,
Mhm.
and I wanted to be boots on the ground type of work with women and in other countries. And I didn't go that route. I don't work for an NGO, but I am boots on the ground, and I'm definitely lecturing in other countries, and I definitely lecture on women's health and hormones. So
Mhm.
it was a good decision.
Absolutely. Well, and you just have to, you know, look inwards, listen to your intuition, chase what sets your soul on fire. And yeah, I was just describing it in the last podcast recording. It's kind of like you're stumbling around in the cold and the dark and it's smoky, but you feel that ray of light that just kind of warms you up from the inside. And it's like, oh, like that direction. And you don't know where it leads. You just have to keep pursuing that. And sometimes you kind of steer off course and it gets like dark and cold again. It's like, oh no, go back to the light. And
Mm-hmm.
you know, here you are, but and you still chase that. But I also think that's how you've got to do it, because I feel like in a way it's almost like this divine sort of calling or responsibility to serve your purpose,
Mm-hmm.
whether that's the story that we make up in our own heads or there's something deeper to it. But either way, absolutely, you need to have the biggest impact on this world possible. And I think that's where, yeah, you know, working privately with patients or clients, okay, that's great, it's super fulfilling, but at the same time, that line is never going to end, you know. So
Mm-hmm.
the way to get ahead of that is, you know, all of the lecturing that you're doing internationally, you're educating practitioners, so you really are having a bigger impact that way. And I'd certainly, you know, commend you for doing all that.
Yeah, absolutely. And it's what I love to do.
Yeah.
Education and empowering, definitely the two E's that I go after. So uh, I'll keep it up.
Yeah, absolutely. Well, you know, I
Yeah.
mean, it's grace medicine involves teach people how not to need it. You
Yep.
know, that's what this whole podcast is all about, is trying to get a lot of good education out there to help people heal and help
Mhm.
people accomplish their best life that everybody loves to hashtag and talk about. But what are we actually doing to get there? So,
Right. It's funny. I read it somewhere, or maybe somebody put a comment on my post about, wait, they were talking about estrogen and progesterone, and then like, what's the optimal estrogen progesterone ratio?
mhm,
And it must have been something I read, and it was brilliant. I wish I would have saved it so I could credit the person, but they were like, there's no perfect estrogen progesterone ratio because every woman is different. Obviously every man is different too, but
mhm,
like the estrogen progesterone ratio that works for me is going to be different from like my mom. It's going to be different from my best friend. It's going to be different from my teenager. And so it just depends on the person. And even somebody who's the exact same age as me, and, maybe even as the same body type as me and the same height as me, when I feel really good, they might feel terrible. Like that, their estrogen progesterone may give them really bad PMS, or like
mhm.
may not be optimal enough. And it just goes back to that personalized medicine. And just really tuning in and tapping in, knowing yourself, and being able to say like, nope, this isn't working for me, or no, I don't feel good, or no, why don't I feel normal? Even
Mhm.
if they tell you like, well, you're at the perfect ratio. It's like, well, for what? Against who? Like, who said it? Right?
Right,
Like, who's perfect? None of
right.
us. So you're really just competing, comparing, looking at yourself at the end of the day. So when you talk about like living your best life, it goes for everything. Just
Yes.
even in your lab work,
Yeah.
you can't, there's no optimal. I mean, there's like guidelines we kind of go by. Like there's just a vitamin D that we kind of shoot for, right? There's a ferritin that we go for. There's a TSH and thyroid we go for. But just because you had a TSH of 2 doesn't mean you feel great.
Right.
It just depends on the person. Same for men and testosterone. So many men are like, well, I'm in normal range. I'm like, well, it doesn't mean it's normal for you.
Right. I'm so glad you bring all of that up. And because you're exactly right. Like, live your best life. But then it's like, we got to really break down even the micro things of what does that mean. And everybody loves to think that the functional integrative kind of line of work is kind of straightforward. Like, you're going to run the test. It's going to tell you exactly what's going on. And it's just the simple equation of, this. But it's not at all. Especially like the Dutch test, it is not. Well, there really isn't such a test that's super straightforward because, as you said,
there's no test.
Yeah, like the microbiome. There's no such thing as like an ideal microbiome. Everybody's microbiome is totally different. Everybody's hormone profile.
It shifts. I was reading this research article that in a drastic change in diet, your microbiome will shift in 24 hours. So if you eat a consistently, let's just say like the quote perfect diet, right? You're like whatever you do that and it's really good, and then you go on vacation. And you're like, screw it. And you have tons of alcohol and you have fried food and French fries because you're on vacation.
Yeah.
And you take, like, within 24 hours, your microbiome is going to change. Now, can it change back? Totally. But, like everything is in constant flux. And even our hormones and the microbiome. And I mean, the skin on, like, everything turns over, right? The skin in the cells in our intestines, the cells in our skin. Like, we're a whole new person.
Exactly.
After a while, we are never the same.
Yeah. All the, I don't remember the exact numbers, but it's like, your liver replaces itself every, 3 months or whatever it is.
Thank God.
I know, right? Poor
Thank you, liver.
Yeah, no joke. Yeah. No joke. So Precision Analytical, the Dutch test has just absolutely become the go-to hormone test, and I've been using it for however long I've been using it, and it's just the best thing ever when it comes to hormones. So I feel like we might as well get this dialogue going early in the conversation of like, why the Dutch test? Because my hope, part of this too, like the functional world, we love our Dutch test, but why are conventional endocrinologists not fully, you know what I mean? And so that's but serum testing, why the Dutch test?
Well, I'll give you my own personal example, because I think a lot of times when you work for a company, people are automatically, you have bias, and I totally get that. I have bias, but I will tell you, so I started working for Dutch in 2012. I honestly volunteered for them. I had an intuitive hit. I got the warm glow in my soul. So what happened was the owner came to the clinic that I was the medical director of and said, I have this test. It's dried urine. Would you be willing to try it? Now, I knew him because in his former life, he was the lab director of a very famous saliva company. And I respected him. I respected his work. He didn't know me, but I knew who he was. And I said, yeah, sure. I'll give it a try. So to give listeners a background, hormones is all I've done, right? I did my residency in it. I did my training in it. What I did in my practice. So I had done blood. I had done saliva. And now I was going to try dried urine. And I had given up on saliva. I would still use saliva for cortisol testing, but I didn't use it at all anymore for hormones at that time because I found it too all over the board, especially if I had somebody on hormones and the numbers would be, exponentially higher than physiologic than I expected. And then the lab was like, well, we adjusted the ranges. Like, I'm like, you're in the thousands. Like, I don't think this is right. Or their progesterone would be, several thousand, and they have all the symptoms of low progesterone. I'm like, something is wrong here. So I gave it up completely. And then I switched to dried urine. So I wasn't working for them when right away, I started working with them in my clinic. We had 9 practitioners and we all started using the Dutch test. And I loved it. And I wrote the owner and I said, hey, it seems like you could use some help. Do you need help? And he said, yeah, I'm a startup company. I can't pay you, but I would love to I need a doctor's input more consistently. He had some doctor friends that he was going to, but not consistently. And I said, well, I've never worked for a lab before. I'd love to learn the field, and I respect you and your work and what you do. Sure, I'll work for free. And so we did that for a while, I believe longer than I probably should have, but I was seeing patients. So we would go back and forth. And then I just kept using it. And then gradually, then I really honestly got hired and then became the medical director. So when people say, well, why Dutch? First of all, it is dried urine. So it's dried urine test for comprehensive hormones. It's an acronym. And the thing about serum is you go to your doctor and say, I want my hormones tested. And they say, great. They'll run estradiol progesterone, maybe testosterone if you're female, definitely if you're male, maybe DHEA, maybe not. And that's it. You get those 4 markers and that's all you get. And if they're quote in range, then you're considered normal. But what they don't tell you is where those hormones are going, and it's the where they're going that we want to know. So I want to know, it's called metabolism. You make an estrogen, where does it go? How does it get metabolized in your body? How does it get used? What pathway is it going down? Same for testosterone. Women don't realize this necessarily, but testosterone gets metabolized and it can go down a pathway that causes hair growth in places we don't like our, upper lip and our chin and around our nipple and on, like on down our neck. And it can cause cystic acne and it can cause male pattern baldness. So we start to lose hair like up in this section, going back. And so, but if you got a blood test and your testosterone as a woman look quote normal, then they're like, well, we don't know why. We don't know why you have cystic acne. We don't know why you're angry. And we don't know why you have male pattern baldness. But yet in urine testing, I can see all those pathways and I can go, oh, well, I know why you make normal testosterone, but what you make goes down this really aggressive pathway and poof, here's your problem. Here's where it is. And so that's why I like urine. And then on top of that, much like your expertise, we can get like organic acids out of it. So we're not an organic acid company, but we do run a few organic acids just that go along with hormones, cortisol, that kind of thing. You can only get organic acids out of urine. And then on top of it, we add in melatonin and we do a whole lot of cortisol markers. So it became this really sort of comprehensive look of here's your estrogen, here's where it's going. Here's your testosterone, here's where it's going. Here's your cortisol, here's how it's made. Here's your melatonin, here's a few organic acids. And you could put together a much bigger picture. And that's why I like the test. And I had tried all the other companies. I've used multiple companies in my career. And so I'm biased because for sure I'm the medical director, but at the same time, like I had an account with every single company out there, almost every company. So I tried it all. I've done it all.
Oh, absolutely. Well, and I love the full explanation because the whole bias thing. It's like at the end of the day, if your soul is aligned with the mission of the company, you know what I mean. It's same thing here where FDN and biobotanical research. It's like what they're all about and what they're trying to do is in perfect alignment with what I'm trying to do. So it's like it's not I don't know the shady bias that people think, but. Yeah, the dried urine technology and all the pathways. I remember when I was first learning the Dutch, kind of an intimidating test to learn. You go from, it's like estradiol and testosterone, and now it's like 2-OH and 2-methoxy. It's just like,
It's not for the faint of heart. I tell people, I'm like, there's the C in Dutch for a reason. We are comprehensive. You're going to get a lot of info. You're going to learn a lot about yourself or your patient or client or, whoever you run it on, which is great, one compact little test.
Oh, absolutely.
Like organic acids, right? You run organic acids and you're like 12 pages later, you're like, whoa, this is a lot of information.
Exactly.
But man, you learn so much.
Yeah. Well, and I think that's something I'm really passionate about in this field is, obviously with functional integrative, there's a lot of practitioners and clinicians that they're not going through insurance, because they want the freedom to practice the way that's going to best serve their clients and patients. And, we're kind of in this healthcare revolution these days, which is exciting and tumultuous in some ways. But I think there's a lot of practitioners out there. It's kind of the shotgun approach of like, let's run like 10 tests.
Right.
And like, hopefully we find something and like, let's throw supplements at every imbalanced marker on every test. Yeah. And it's just like, that's not a sophisticated, intelligent clinical investigation. So I'm very adamant about it depends on the clinical presentation, but like the 3 tests that I just will not work with a client without, the Dutch test, the organic acids, and some good old-fashioned unsexy blood chemistry.
Yeah.
You know what I mean?
Yeah, absolutely.
If we're talking bang for buck, that's going to be an enormously powerful amount of data. And then the correlations too. And I love the organic acids that you guys have been adding, like the 8-OHDG is one of my faves.
Yep. Oxidative stress marker. It's a big one. Yep. DNA damage. And man, when it's high, it's definitely scary. But the great thing is you can do something about it, which is right? Like it's a movable marker, and that's what I love. People are like, what do I do? I'm like, it's antioxidant based. It's your oxidants, it's your reactive oxygen species. It's those that are causing the DNA damage. So let's address that. One, remove whatever you've got exposure to, and then two, let's clean it up.
Yeah.
And that's been really, really cool. It's also been cool to sort of track it somewhat with cancer. It doesn't always track with cancer. Everybody always assumes because it is a DNA damage marker that if you have active cancer, then it should be really high. Sometimes it is, and sometimes it's not. And sometimes it depends on the person. We definitely will have people who were already seen holistic practitioners, functional practitioners. So they're on some sort of antioxidants, they're getting IV therapy, they're doing things. And by the time they run the Dutch, I'm like, well, I would imagine your numbers are improving because you're actually being quite proactive about it from a nutrition standpoint. And so that's like really helping the marker. In fact, we had a practitioner who had breast cancer, and by the time she ran Dutch, she did IVs in her clinic. And so she'd already had several IVs, and she had a whole, sort of functional oncology supplement plan that she had gotten tailored to herself. And by the time she ran Dutch, her 8-OHDG was not high. And she said, but I have cancer. So yeah, girl, but you're taking care of yourself, like you were doing all the things to help your DNA. So it's entirely possible it was high, 3-4 months ago, but now that you've been very, very aggressive and active in it, then you've improved yourself.
Yeah, absolutely.
So, yay.
Well,
yeah.
I mean, when in doubt, test, don't guess, right?
Test, don't guess. It's my most favorite thing.
Absolutely.
My most favorite thing. It's my new, right? Like now on Instagram, I'm posting all about estrogen detoxification. And and I understand completely that people are desperate and people are sick and people don't feel good and they don't have the money necessarily to go to a practitioner who doesn't take insurance and then run these extra tests on top of it. I get that. But at the same time, the number of commenters who say, oh, I did that, I just started supplements and got worse. You're right. And my example on Instagram was about DIM, diindolylmethane, for estrogen detox. And DIM is like the poster child. It's the supplement you should take for estrogen detox. So, but for those listening, before you run out and buy it, like don't, hold on. It's the poster child, but nobody fully understands, or nobody's been really sort of taught that it only works in one of the phases of estrogen detox. And if that's not the phase that you have problems with, you will actually do more harm than good. And the number of women who wrote and said, yeah, that was me. I got on Amazon and ordered DIM and I got all these symptoms. I felt terrible. I got headaches. I got acne. I'm like, yeah, because you just upregulated your phase 1, which is what it's good for, and you neglected the other phases. And so you actually did more harm than good. And so that's been really eye-opening for a lot of people who are like, oh, I guess I should have tested first. I'm like, yep, it's, you have to, it's supplements, not all supplements are like DIM is actually quite active. It's a very active supplement on a very specific part of the body, and you got to be careful.
Absolutely. It definitely takes that professional knowledge of the biochemistry behind it to navigate those pathways, because absolutely you could be exacerbating, whatever kind of blockage within whatever pathway we're talking. I just got somebody slid into the DMs yesterday asking about, liposomal glutathione and like, hey, do you think I should just like grab a bottle and try it? I was like, I see advertisements all the time for glutathione, but it's not exactly something I'd be throwing down people's throats without, some
context and history. Yeah, I literally had somebody write me today, and she said I'm on N-acetylcysteine, NAC, which makes glutathione, right? And she said, is that safe? Can I just keep taking it? I was like, I'm not your doctor. I can't give you medical advice. I don't know. Like N-acetylcysteine is generally, pretty safe, but at the same time, like I don't know. I don't know what to tell you. I do use it. I do love it. For you, I don't know.
Yeah. Well, it's, nutritional biochemistry is immensely powerful. And, certainly it's like our nation has kind of been trained of like, oh, if something's wrong, you pop a pill. And so everybody's looking for what pill to pop. I get that. But it's like, well, we've got to understand the highly individualized nature. And so I always, tell clients like, okay, your metabolism, its own, unique 1,000 piece jigsaw puzzle.
Right.
And, each lab test that I'm going to run is going to give us a handful of puzzle pieces. But, I've got to be able to put those puzzle pieces together to be able to best guide whatever, protocol considerations, we want to input here. But, the Dutch test, something I was thinking about with like the 8-OHDG and oxidative stress, and, every disease component or every disease process has an oxidative stress and inflammatory component. And I think the Dutch test, as opposed to like serum or any other type of hormone testing, does an amazing job of kind of elucidating patterns related to oxidative stress, either damage or potential with some of those phase 1 metabolites and whatnot, or inflammation patterns. You speak to that a little bit.
Yeah, which is great. So everyone wants to know about inflammation. Am I inflamed? What marker can I run for inflammation? And just like you said, so on the Dutch test, there are a few patterns we look for. On the Dutch test, we look at DHEA-S. The S is the sulfated form. So you have DHEA, and then you have DHEA-S. And so the S is the inactive form. To get the S on the DHEA requires your salt SNP, which makes an enzyme that puts the S on. Inflammation, the more inflammation you have, whether it's skin or gut or chemical or joint or whatever you got, it will reduce that. So when we look at the Dutch test, if I see your DHEA-S is lower, but compared to the other androgen markers, so we check testosterone, we check something called etiochalanolone, something called androsterone. If those are all normal or even high, and I see the DHEA-S is lower, then I'm thinking immediately inflammation. That or just a sulfation issue in general. The other things I look at, I'll look for a higher metabolized cortisol. The more inflamed a person is, generally the more cortisol the body puts out and metabolizes, because cortisol can be anti-inflammatory to a point. And so if I see high levels of that, then I'm starting to think, I bet you've got some inflammation. Men, aromatization increases with inflammation. So if a man is making too much estrogen, if his testosterone is going to estrogen, then I start to think inflammation. Now, insulin can do it as well, having too much insulin. And it happens in fat tissue. So men who have excessive amounts of fat tissue, belly fat especially, they will have higher amounts of estrogen. But some of these patterns, as they come out more and more, I'm like, I bet you've got inflammation. And it's really interesting that you said earlier about practitioners who just shotgun approach and order all these lab work.
Yeah.
So sometimes then practitioners will go, okay, well, what do I do next? What supplement do I give them off the Dutch test? I'm like, no, you have to address the inflammation. Or they'll say, okay, I want to suppress their cortisol because it's high. I'm like, no, maybe. But if it's high because they're inflamed, let's pretend they have, they're in the gut, right? They've got candida or bacteria or SIBO, small intestinal bacterial overgrowth. They've got whatever. They're eating something they shouldn't. Every day they have dairy and corn and they should not have dairy or corn, whatever it is. Yeah. I'm like, if you eliminate those things, then the cortisol will naturally go down. So if you suppress the cortisol, you haven't fixed the cause. All you've done is put a Band-Aid on the cortisol. Right. And so that's why looking at those patterns is really nice, that I can say to practitioners, what else is going on? And it's amazing the number of practitioners who come back and go, oh, they have stealth infections, right? They have Lyme, they have mold, they have whatever it is, Epstein-Barr. Like, address that. You go after that, their DHEA-S will go up. If you address that, their estrogen, their aromatization in men will go down. If you address that, their cortisol will come back into normal. So don't give out supplements for all these arrows. Like, don't give an aromatase blocker, don't give a necessarily, but unless you're addressing the inflammation or the infection or whatever it is. Because
it's really it's really about making sure you're not treating the piece of paper, and you're you're treating the whole person, and kind of putting on your critical thinking hat of let's think more critically rather than just throw supplements at a piece of paper and hope because the body's doing it for a reason, right? The body is upregulating, downregulating, shifting all these biochemical pathways. Like, there's a reason for it. It's not accidental.
Right. It's like people who tell me that they get diagnosed with the deadly MTHFR, disease. I have MTHFR. I'm going to die of MTHFR. I know. And I don't mean to make fun of those people, but I'm like, ooh, you guys, it's not like that. like it's kind of been way blown out of proportion. And it depends on the person. So I get a lot of comments. I have MTHFR. Should I take folate? I'm like, well, not necessarily. I don't know. People have MTHFR and have no issues with folate. None.
Right.
So if you don't have an issue with folate, then you don't need it. Like, don't take it. Let's look at some other things. Or even with estrogen detox, it's actually comped COMT. MTHFR is a small piece of that puzzle, but with COMT, then everyone's like, oh, I have COMT. I've done genetic testing. I'm going to take all the supplements. I'm like, well, hold on. Let's see if your COMT is actually a problem. And on the Dutch test, we can see how your estrogen is an example, how your estrogen, it uses COMT to go from phase 1 to phase 2. So if you're doing it normally, then you don't have, yes, you have a COMT mutation. No, it's not showing up. It's not manifesting on the lab work. Don't do anything about it. You're fine.
Right.
Why would you take all the supplements if you don't need to?
Yeah.
Your body's compensated. It's doing great. It's found other pathways and other means, and it's doing great.
Yeah. It's pretty mind-blowing. I think, I guess this has always been true, but especially today, we have so much amazing technology, but it definitely feels like our technology has greatly surpassed our understanding, especially, I would say, with genetics and the microbiome. Like, we have all these fancy tests of being able to measure this and that, but it's like you get that genetic report back and it has like thousands of SNPs. Yeah. It's like, oh my God, I'm going to die. And like, I need to take 1,000 supplements for all my 1,000 SNPs. It's like, well, the genetic code tells us nothing about your current state of biochemistry.
Exactly. Exactly. And I'd say a lot of these testing, unfortunately, and I work for a lab company, it's gotten rid of a lot of people's critical thinking skills.
Yeah.
Like everyone just looks at the piece of paper and it's like, oh, it says I'm low. I'm going to take it. Like, whoa, hold on. Like, let's critically think about this. Do you actually need it? And what's really going on in the big picture, which, but again, I understand it's hard and it can be expensive and it can be time consuming, and we all have this, can't I just take a pill for that and get insurance to cover it mindset. And we need a big mind shift around that. It's just, humans are getting more and more sick, and we have more and more exposure. Our food quality is getting worse and worse. And so it's going to require time and energy and money more than it ever has, unfortunately. I'm not saying it's fair and I'm not saying it's fun, but it's definitely something we have to like shift our mind around.
Yeah.
Actually, Ben Lynch, you know Dr. Ben Lynch?
Yeah, I love him.
He posted on Instagram recently. Somebody wrote him a message, a DM, and said, I don't have time to read your book, Dirty Genes. What would you suggest I do to help myself? And Ben was like, if you don't have time to read the book and help yourself, like, I think you need to reprioritize here. Yeah. You're not willing to put your health as a priority. You're basically looking for me to give you the cliff notes, the short version of how to, quote, fix yourself. And that's just not going to happen. And I was like, holy Moses, that person is never going to get better, because they're constantly looking for the shortcut. They don't want to do the work. They don't want to put the effort in, but it's their own body. We only get one, we get one, right? One life. So you gotta put the effort in.
Yeah. I'll bite my tongue right now so I don't go into a tangent about like victim mentality, but
no, go in it.
Well, I mean, it's so true though. And that's something I'm uber passionate about is, and again, that's why this podcast, it's not just about fitness or medicine but also the spirituality and psychology. Because I think, any holistic healing type professional, no matter what their credentials, they definitely recognize just the holistic nature. And especially, like, I just had that post the other day about, your health is a yin yang of psychology, physiology. And it's like, we literally have abundant amounts of literature and research that shows the power of our psychology, our outlook, our psycho-emotional, spiritual energy, and how that literally changes our physiology and biochemistry. It's like breathing exercises change your immune cytokine response. And it's like, so then you start thinking about and that's the thing is, I want to make sure I'm not like picking on the masses that do allow their ego to kind of take over, like drunk on instant gratification and high on the American dream. And because I think it all goes hand in hand. I think the chronic disease epidemic, the mental health crisis that we're all in, it all goes hand in hand. I think people are very kind of locked and stuck and paralysis by analysis. So they just kind of get stuck in these nasty psycho spaces. But I think that's where, kind of the functional medicine industry is really the tip of the spear, leading the charge of like, guys, let's change this, let's use some valid science, and evidence-based protocols to guide in the right direction. I could go on and on,
Right. I know. And just I tell people, just be proactive. It's your health and your body. And the only person who's going to help you the best is you. And so when people, we were talking about this before we recorded, when people write us messages, sometimes I can tell these people never even read the post in the first place, whether it's a blog post, a Facebook post, an Instagram post. They're just writing these questions in. And sometimes I feel really bad, but I just want to be really kind of blunt and say, did you even read the post? Like, you didn't even put in that effort to read. Like, and if you did, you could help yourself. Like, I am making it plain as day. You're making it plain as day. All these other healthcare practitioners are giving all this free content. All you have to do is read the post, and then you will have your answer and you will feel better. But instead, you've chosen not to read the post and then just ask for free help. And I'm like, I can't help that. I can't help you. You have to just read the post. It's literally right above your comment. Just scroll down a little bit,
right?
And put in some effort. And so I can't tell if, and I know, half of it, people are overwhelmed and overworked and there's so much information out there now. But on the other hand, I think people have just lost that critical thinking, and they want it just handed to them, and they don't want to work for it. And that's tough. That's never going to get better. It's your health. You have to put the work in for it. I can't fix you. You can't fix me. I can only fix me. So you can guide me. You can help me. I can read your stuff and learn. You can coach me, but I still have to do it. I have to put the food in my mouth. I have to get off my ass and exercise. I have to take the supplements. I have to do these, change my mindset. I have to meditate. You can't meditate for me. I have to journal. You can't journal for me. And so that's where I think people get really stuck. They're like, well, can't you just do that?
Yeah.
No.
That was holistic AF. You know what I mean? That's what's up. I love hearing that, because that's, literally in my podcast trailer promo or whatever the hell it is. I go on this tangent about I firmly believe the only person that can heal you is you, and the title doctor, this is because originally I was working as a personal trainer and nutritionist and going to school, working full-time, going to school full-time, pre-med, and similar to you, just the path didn't make sense for what my soul was kind of calling from me. But ultimately, too, the word doctor is a Latin word that means to teach.
Yep.
And so that's what this is all about. I couldn't be more passionate about it. You literally just articulated all of that perfectly. Of, you can't be looking externally to make yourself happy and find something externally to fill the void that's within your soul. Only you can look inwards to fill that. Or when it comes to healing and reclaiming your health, exact same thing. You can't be looking to some, please, doctor with your white lab coat, fix me, heal me, save me, I'm helpless. No, so I tell my clients during the consultation, look, I'm not in control of your health. You are. I'm here to be your spirit animal and your guide along the healing journey as we navigate the treacherous terrain of your physiology. But it's awesome to hear, obviously a leader like yourself saying the exact same thing. Yeah.
And trust me, if you could pay me a boatload of money and just let me meditate for you and journal for you, I will do it. I mean, if you want to, some people listening, if they're like, well, I'll just pay her to meditate for me, I will take your money, because I love to journal and I will be happy to journal for you. But it will get you nowhere. It'll get me a lot of where, but it will get you nowhere. So, save your money and you just have to do the work.
Totally.
Yeah.
All right. So we're going to talk, because when we were having dinner in Portland, we were talking about crystals and spirituality, and I want to go there. But first, estrogen dominance.
Yes.
Estrogen dominance is everywhere these days. And certainly there's way more information. I feel like everybody, I remember when I started my career as a trainer, if you were like a fitness professional that was kind of talking about some things hormones, it was like, oh my gosh, you're so impressive. Whereas now, if you're not talking about hormones, it's like, oh, you're a dinosaur, get out of here. And
Right.
now it's like when people are starting to talk about gut health, you know, it never ends. But nonetheless, though, estrogen dominance, if there was like a single hormone profile pattern that we just see over and over and over in men and women, it's pretty much everywhere. Like,
It's
what was,
very, yeah, it's very common. And just for so people understand, in men and menopausal women, it's different. In cycling women, it's estrogen. So our estrogen goes up and down, right, through our menstrual cycle. So it goes up. It's low it's low during our period. Then it spikes up high right before we ovulate. We need that spike in estrogen. That's normal to get us to ovulate. Then it comes down. We ovulate, kick the egg out. And then it comes up again. It's like a second little baby bump. And then our progesterone comes out much higher. So when we talk about estrogen dominance, we're actually talking about estrogen in the second half of our cycle, after we're supposed to have ovulated, leading up to our period. And so it's that second half where estrogen gets out of balance is relative to your progesterone. And so you can have a relative estrogen dominance because your estrogen is normal, quoted in range of the lab, but your progesterone's quite low. Or you can have normal or good progesterone, but your estrogen is still high because you either take too much, make too much, or you can't detox it out of your system. And so that's what we're talking about. Now, men and menopausal women are a little bit different. Men can be estrogen, quote, dominant all the time because they don't cycle, right? Some men PMS for sure, but they don't, like, we don't, right? You guys don't ovulate and have cycles and all that, or menstrual periods and stuff. So men are a little bit more consistently, right? They'll have higher estrogen all the time. Menopausal women are a little different because they have very little estrogen once they go through menopause. The cells on the follicles of their ovaries are done, they're gone, they don't make hormone anymore. And then women, we make some estrogen out of our fat tissue from that enzyme aromatase, and that's how we maintain some estrogen. So women, if you're taking estrogen, that's where you can sort of push yourself more into estrogen dominance if you're out of whack. But yeah, I would say, and then for symptoms, because everyone's like, well, what's a symptom of estrogen dominance? It's usually like the classic PMS stuff, right? It's mood changes right before your period. It's heavy periods, clotty periods, cramps, breast tenderness, breast enlargement. It can go with PCOS. It can go with endometriosis. It can go with fibroids and polyp development. Men think like breast development, belly fat. They're more depressed. They're less motivated. They have erectile issues. It sounds like low testosterone symptoms, but it's actually estrogen have very, very similar symptoms in men. So yeah, this excess estrogen is super common. And unfortunately, again, like I said, it's because you make too much, you take too much, or you can't clear it. But what the category I forgot is the chemicals. So it's the xenoestrogens. It's the stuff in our environment that look like estrogen. They don't necessarily raise our actual estrogen count, but they bind to the receptors and do the things, right? They look like estrogen keys. So they bind to that estrogen lock and turn it on. And so when you test, your test might show, quote, normal levels of estrogen, but you have all those symptoms because you're just loaded down with chemicals we can't quite test for. And so and men can too. Men are the same way. And so it's very, very common nowadays. Yeah.
Absolutely. It's kind of, I'm super glad you brought up the, xenoestrogens, xenobiotics, and, that's its own, we'll have to, I don't know, have a podcast just about that eventually.
That's a big one.
The environmental toxicants, I think anybody that studies all this stuff, it's like, okay, infections, parasites and mold and, living biological organisms, microorganisms, we've evolved with that stuff, for a long ass time. But I think what is horribly terrifying that is very much new, and the psychology stuff, that's a different conversation, but really just from a physiological, the environmental toxicants and I think the radiation with
EMF,
4G, Wi-Fi, all this shit. But the xenoestrogens, I think that is huge. We're killing off the planet, and I think we're seeing a lot of this reflected. And as a result, I feel like we're seeing a big rise in hormone replacement therapy, really kind of being used allopathically. I think there's a lot of run a hormone test because you have hormone symptoms. This is low. Let's pump you full of this.
Right.
I don't know. I'd love to hear your take on some of that.
So I have a little bit mixed on HRT, hormone replacement therapy.
Mm-hmm.
I like HRT. I get asked this question a lot. Do you believe in HRT? Yep, absolutely.
Yeah.
I can prescribe it. I have a DEA license. I can prescribe it here in Oregon, and I do. And I think, obviously, women forget when we talk about hormone replacement, it can be lots of thyroid. Women are on thyroid medication. That's hormone replacement therapy. It's just thyroid. And in the United States, we can get DHEA over the counter. Vitamin D is a hormone over the counter. Melatonin is a hormone. It's over the counter. And then testosterone has to be prescribed. Progesterone, you can get some forms over the counter. And then there's estrogen. So I get asked, do you like hormone therapy? Yeah, but I test and I take a history into account and symptoms. And I'm very careful on talking about side effects and things like that. But estrogen is what gets the really bad rap, right? Estrogen is like, oh, I can't take estrogen, I'll get breast cancer. It's like, well, there's a really amazing book. Actually, I think it's right here. This one, Estrogen Matters. And it's by Avram Blooming and Carol Tavris. Oh, sorry, Carol, I just butchered your name. But Estrogen Matters, I've highlighted pretty much the whole thing. But what it helped just to remind me is the importance of estrogen for women, for brain health, bone health, skin health, heart health. Mm-hmm. And so I see a lot on social media where practitioners of all walks of life, walks of training, vilify estrogen, right? Mm-hmm. We need to get rid of estrogen. We need to suppress estrogen. We need to kill off estrogen. We need to cleanse estrogen. And I'm like, except it's estrogen that is preventing you, hopefully right now, from getting Alzheimer's and dementia at a young age. It's estrogen that's making you not osteoporotic. It's estrogen that's helping your skin be youthful and supple and healthy, right? It's estrogen that's protecting your heart and your blood vessels at a young age. And then we go through menopause and our estrogen goes from great to zero almost. And we lose that protection. And so a lot of practitioners will talk about, well, menopause is normal. Just let it happen, suck it up, do the best you can. And I take the opposite stance. And I'm not saying estrogen's for everyone. I'm not saying that at all. But I am saying, humans live a long time now. We didn't used to. So normal is relative. Mm-hmm. And we actually don't know as much about menopause, I think, as we think we do. And I think I would prefer not to have Alzheimer's, and I would prefer not to have heart disease, and I would prefer not to break my hip, and I would prefer to have like clear, good looking skin. Although of those three, skin is kind of like the last thing. I'd prefer my brain and my heart and my bones. And so I think women forget that, like, we actually, estrogen's really, really helpful. It's what makes us women, and it helps our mood, and it helps us in the right balance. It helps with like our weight distribution. And so with HRT, I'm not against it. And in fact, I lean much more pro estrogen in the right person, but I'm doing the right workup. Mm-hmm. For sure. So that's how I feel about estrogen. And I get asked a lot too, well, can I just take an herb for that? Can I just take black cohosh? Can I just take maca? I'm like, you can for symptoms. Absolutely. You can take black cohosh and maca and red clover and vitamin E. Like, they all have been shown to be helpful for some symptom management, but are they going to actually give you the brain protection? Are they going to raise BDNF? Are they going to lower plaque formation? Are they going to help your blood vessels stay, elastic? Mm-hmm. Nope. Yep. Are they going to, help? And with bone health, it's not bones, it's bone resiliency. It's bone density and bone resiliency are two different things. Bone density is how like thick they are on DEXA scan. Resiliency is when they bend, how much can you bend or put pressure on them before they break? And those herbs aren't going to help those things in your bone. So totally. Those herbs aren't going to help collagen formation in your skin. And so that's where I'm like, big fan of the herbs and everything, but at the same time, don't vilify estrogen without properly understanding it. Mm-hmm. Because people coach out there and they post all over out there about how it's the worst thing ever and estrogen's bad and it's all bad. And I'm like, except it's not.
Yeah, right.
Except, let me give you some basic biology on estrogen. Yeah. And again, I know I keep talking, but
You're good. You're good.
I get I'll get pushback from people with severe endometriosis or, fibroids. I'm like, oh, I know. That is not fair. And those people, I feel like, absolutely, you got the short end of the stick. Endometriosis is the worst. Estrogen is not the only thing that triggers endo, though. There's a lot with inflammatory cytokines, infection, gut microbiome. Endo is a lot bigger than just estrogen, even though it's very estrogen related. And so, but again, I'm like, you still don't want osteoporosis, dementia, or heart disease. Some of these women who are like, all right, I'm going to have all my ovaries removed. And I'm like, oh God, are you sure? Okay.
Yeah, if we can avoid having organs cut out of our body, I think that's usually a good way to go.
Yeah. And I get that question a lot too. I have a lot of women in their 30s who've had their hysterectomy for whatever reason, a full hysterectomy with their ovaries gone. And all of them write me and they're like, I didn't know. Like, my memory is terrible and my skin is terrible. I've aged overnight. I've put on 30 pounds. My joints hurt. My mood sucks. Like, my libido went away. My vagina's dry. I'm like, yep.
Yeah.
Yep. And maybe they needed it. Maybe they had ovarian cancer, right? Maybe they had like something with their ovaries that it was absolutely required, but at the same time, then nobody teaches them the importance of hormones in the female body. We just think, oh, hormones, have a period, ovulate, make a baby, maybe. And I'm like, no, they're systemic. They're very systemic. They affect literally everything.
Yeah, absolutely. It's such a good, thorough and well thought out answer, because I think a lot of it too, again, not to go into that tangent, but just kind of the crisis of ego at the wheel is kind of what I think of it as. And everybody, a lot of bandwagon stuff and a lot of like latch on to a little bit of something that kind of sounds sciencey. You know what I mean? It's so relative and so situation dependent. But also too, there's too much, with like conventional versus functional. Why is it versus? Like, I'm trying to like save the damn planet here. But then, you've got functional people that kind of demonize anything that's a prescription. If it's a synthetic drug or or bioidentical hormones, it's like, oh, nothing but natural. And it's like, okay, I'm a big fan of always looking at nature to guide our critical thinking, because like nature has been doing what nature does for millions of years. Our species has evolved for the past 200,000 years.
Right.
I think there's a lot to be learned by looking at the natural progression. However, boom, we have this amazing technology. You look at technology today versus 100 years ago versus like 1920 to 1820. All right, it didn't change that much from 1820 to 1920, but it sure as hell changed a lot from 1920 to 2020 or whatever we are right now. So my point being, though, I think we have to use the best. Like, let's use some good critical thinking, but why not make the most out of the technology available to us? And so I think HRT, it's almost like the pursuit of the superhuman, because maybe in the past we had to, menopause, like that's just the natural way of life. And so it's like, well, just because it's natural doesn't mean we can't, work intelligent.
Optimize it.
Right. Exactly. Yeah. So I think the intelligent use of hormone replacement can be amazing. And a lot of times too, I get a lot of dudes that come to me like, yo, bro, low testosterone, man. Like, what do I do? And you can kind of chase that rabbit hole of like, well, it's probably because of these trillion reasons. So we have to run 100 tests. And it's like, at the same time, we've got to focus on like, this is a human that wants to increase their quality of life right now. And a lot of times too, if we can do something that's going to powerfully make them feel better, we're going to be able to increase the trajectory and momentum of whatever health building program they go into. But I think a big part of it is like, if somebody wants to use hormones, great. That's where I always tell them, like, we need to use Dutch testing to really be monitoring the effectiveness of the HRT. Because I kind of picture it like, you've got this complex piping system that's all of your biochemical pathways, and you got that funnel at the top, and it's like you're going to dump a big bucket of water But then the question becomes, how are those hormones being metabolized? And we can't tell this off serum, and
Right.
that's where
Right. Or saliva for that matter.
really shining is we can see the 5-alpha reductase activity or the 2,4-16-OH pathway. So,
right.
there's going to be a mix of people listening to this thing, a lot of practitioners, a lot of trainers, a lot of just people. But I'd love to, before we then kind of move into like a little bit big picture, holistic spirituality, the estrogen metabolism and because I think that is one of the kind of focal points of the Dutch test. And one of the most robust parts of it is, we've got these 3 primary estrogens. We have the 3, phase 1. I'd love to hear, the hormone queen speak to estrogen metabolism a little bit, like the 101 for dummies that, don't study this stuff for a living.
Aren't fully aware. Okay. So you have estrogen. This applies to men too. I get this question. Do men have the same metabolism pathways? 100%. Yep. You have estrogen. You have E2, estradiol, E1, estrone. They go through phase 1 detoxification. When you go through phase 1, you have 3 pathways you can choose from. Your 2 pathway, your 4 pathway, and your 16 pathway. They become 2,4,16 hydroxy is what we call them. And so the 2 is less carcinogenic. It's not no carcinogenic. Everyone assumes it's healthy. It's not healthy. It's just less carcinogenic. The 4 has the potential to be much more carcinogenic. We definitely want to minimize the 4 pathway. The 16 pathway is what I call proliferative. It makes things grow. So it can increase your breast size at PMS. It can make your periods heavier. It can make fibroids and polyps grow, those kind of things. But it's also somewhat helpful for bone growth, bone health. So it, Goldilocks, right? We want just enough. So that's phase 1, 2, 4, and 16. They are known as reactive oxygen species. So for those of you who know much about detoxification, sometimes your body turns a chemical into a worse chemical before it turns it into a neutral chemical. This is one of those times. Your estrogen gets converted into something that's actually worse, and then it has to neutralize it. So phase 1, they make it worse, neutralizes it through phase 2. So once you go through phase 2, that's where you go through COMT, C-O-M-T, which is what we talked about earlier. The COMT, the MT stands for methyltransferase, and it gets a methyl group on the estrogen, and that basically neutralizes it, makes it water soluble. Now that you're water soluble, you're very safe, and you can get excreted out of the body. So you're a water soluble estrogen, you're in the cell, and you need to get either urinated out or pooped out. So your body takes a little transporter, transport you across the cell membrane, like you get in an Uber, and your Uber drives you across the membrane, and dumps you either into circulation or which gets you to the bile or gets you to the kidneys. That's phase 3 detoxification, out of the body. Once you're in the bile, in the intestines, and then you go out, because you're packaged to go out. You can have problems at phase 1. You can be a person who your phase 1 is really slow. You can be a person who goes down too much of the 4 pathway, too much of the 16 pathway. You can have a problem at phase 2. You don't put the methyl on your estrogen. You don't neutralize your estrogen very well. You could have a problem at phase 3. So you could have very slow Uber drivers. You could have problems with your bile. Maybe you're missing your gallbladder. Maybe you have constipation. Maybe you have a lot of gut issues. You have a parasite, bacteria, microbiome issues, candida, and that's screwing everything up. And so I teach it as phase 1, 2, 3. That's the order it goes in. But you address it 3, 2, 1. You have to be pooping and peeing regularly, and then you neutralize it, and then you work on phase 1. And so it goes back to the conversation we were talking earlier about DIM. Everyone jumps on DIM. That's just phase 1. If you have a phase 1 problem, great. If you don't, if your problem is at phase 2 or phase 3, then all you're doing is making your estrogen convert into a reactive oxygen species faster. You are increasing your carcinogenic risk higher. So you have to treat 3, 2, 1. Make sure you're focused on gut health first, then back up to the liver. So that's how you go through phase 1, 2, and 3.
I love
and
that.
Same applies to men.
Totally.
Yep.
Well, and I like to, every analogies always are helpful for learning. So I always explain to my clients, it's kind of like, a sink, right? Of you want a certain water level in the sink. So you've got a few ways to control that. How much water is coming into the sink, how much water is draining from the sink. So it's just kind of this little bit of equation of like, oh, your sink is overflowing because the drain is completely plugged and the faucet is on full blast. And so, that's exactly what you're speaking to right now is we have to be thinking of that sink. And it's like, well, let's make sure the drain is open before we start speeding up.
Actually, if you back up from that, because my analogy is always a clawfoot bathtub, always. And so, right, water coming into the bath. I've been teaching about this for years. Water coming into your bathtub is phase 1.
Yep.
So how fast is it? How slow is it? Is it 2 water? Is it 4 water? Is it 16 water? The ability of your drain is phase 2, right, to get the water out of the liver. And then the pipes out of your house that connect to your sewer system are phase 3, right? Because you got to poop it out. So if your sewer pipe out of your house is blocked, but you just keep turning on the water and you just keep focusing on the drain, you're still going to get a blockage. You're still going to get a backup up into your clawfoot bathtub. So you have to fix the blockage at the sewer line before you can fix the drain in your clawfoot bathtub, before you can address the water in the bathtub. Now, you can do all 3 at the same time, but just make sure you focus on that sewer line first. You have to.
Yeah.
Yep.
Absolutely. And if you're not doing the Dutch test, you're going to have no damn clue about any of this.
Well, Dutch in combination with the stool test.
Yeah.
Because the stool test has to look at your microbiome stuff, but specifically your beta-glucuronidase.
Yep.
Beta-glucuronidase is that enzyme that will cause estrogen that's going down the sewer line to get reabsorbed back into the house. Back into the house. And we don't want that. So,
exactly.
Yeah. Got to fix it.
Love the synchrony going on.
I know.
Whew. Cool. Well, very cool. So, man, hormone. I mean, that's the thing. We could easily talk about all the. I mean, it's like we could have a full episode about. Well, and that's where I love, watching you and Ralph. You guys have your, hormone series like his and hers.
Yeah, our his and her. Yeah, our Instagram lives. Yeah, we've just gotten distracted and sidetracked and. But yeah, in fact, I just talked to him yesterday for a solid hour. So we need to get back on that.
Yeah, those are great because you get like the guy, female, it's the yin and yang, and it works. It flows really well.
Yep, my New York Italian brother from another mother.
Yeah, I was supposed to have him for a webinar tonight for FDN. I think he had to reschedule, but we'll get him September. And I commented on I think my own Instagram post and was like, I see you, Ralph. Like, I'm going to drag you onto this podcast too, right?
Yep. I told him. Yeah, he texted me this morning. And he was like, "Oh no, I can't do the FDN. Do you think it'll be a problem?" I was like, "Just text Brendan. It'll be fine." I'm like, "Oh, well, I'm gonna be on with Brendan in a couple hours, actually, on his own personal podcast." Yeah,
no, it'll be fun. He's I'm really glad I met him in New York. He's a good guy, that Dr. Ralph.
He is amazing. Yep, one of my best friends.
Very good.
Yeah.
So, crystals and spirituality, we're talking holistic, we're talking, Dr. Jones is willing to meditate for any of you listening for the right price.
Or I'll journal. I prefer journaling. In fact, I have my journal right here.
With your journaling, because I know we both, are friends or talked to Dr. Nicole, the holistic psychologist, which I'm dragging her on this podcast, I think in September's. Do you do her future self journaling, or do you have your own style of journaling? Or
I have my own style. Yeah, I have my own style. I've always, since I was a kid, I love to write. And so I've been doing journal stuff for a very long time, off and on. And so I kind of just sort of developed what I like to do for journaling. So I do my 5 daily affirmations, or not affirmations, my 5 daily gratitudes. So 5 things I'm thankful for. And then I do, and I just divided it out. It was 3. Wait, hold on. I'll tell you. I'll count them. 1, 2, 3, 4. 4. 1, 2, 3. Yeah, 4. So then I have 4 daily affirmations that I have for myself that I write every single day. And then I sort of go through just like journaling stuff, either what I'm feeling, what I'm thinking, or just positive what's the word I'm looking for? When you say like I am, or this, like present tense stuff, even though they're my wishes for the future, you put it in present tense, like whatever, like for somebody who's like
an affirmation.
So you say like I am, like for like somebody who's struggling with like I am happy, I am fulfilled, I am, versus I will be. Don't put it in future tense. because it's not, that's will be, may or may not be attainable. So you always put it, or like for people who are looking to exercise, right? Like the people like, I wish I could exercise 3 days a week, but what you change it to is I exercise 3 days a week. Whether you do it or not, it doesn't matter. You put it out to the universe that this is what you do. It's present tense. So anyway, I have 4 of those that I write down. Then 4 affirmations. Then I journal, and then I pull oracle cards. Yes, which I have right here. These are my favorite. And I have my new dog. Chewed the shit out of him. Yep. He did not get the cards. He just got the box and part of the book. But these are my favorite cards. I have zero affiliation to them. They just work for me. There's a million cards out there. And people will ask me, like, well, what do you mean by you pull cards? I'm like, have you ever been in a store and they have like a little thing of like daily cards and you just pull and it'll say like happy or loved or gratitude or whatever it is. I'm like, these are like that, but expanded. And so, in fact, I've given them to 2 of my best friends for Christmas. I just gave them to Nicole Jardim the other day because she was having a bad day. So I sent her some off Amazon. I'm like, girl, do you pull cards? You need cards in your life. And sent her these. So I ask questions to the universe. Sometimes I just pull a card of the day. Sometimes I'm like, tell me what I need to know. Yeah. And then I tune in and pull a card and then I'll journal about it. It doesn't take me very long. It sounds like it takes me forever. And people are probably thinking I journal for an hour. I don't have time for that. Yeah. But I have my routine down. I know what I'm doing. And I journal a little more at like the new moon and the full moon. There's a really good book. Again, I have zero affiliation. I just love it. It's called Moonology. Oh, cool. By Yasmin Boland. And she's big on working with the moon, especially the new moon, for making wishes and I just love it. I have the whole thing highlighted and so I feel very like moon centric. The moon talks to me a lot. The moon gives me a lot of really good advice in my life. The moon is what told me to go to naturopathic medical school. Literally, I went to go for a run one day at night. I used to run at night and I don't run anymore because screw that. But I used to. And I went outside. It was a full moon. I looked up at the moon. I was like, wow, that's so big and bright. And the moon was like, you need to go to naturopathic medical school. And I was like, okay. I turned around, went back in the house and I called my girlfriend and I said, I think I'm going to naturopathic medical school. And she's like, yeah, it's a great idea. So I work with the moon stuff. I love that. It was, which people don't expect out of me. People expect that I'm all PubMed and Google Scholar, and I am all those things. I totally am all those things, but I believe in the universe and all as well, and my wisdom cards and journaling and my positive mantras, and it works. That's the thing. It's like I feel like it absolutely works. So. And it's for me. I do it for me. I don't do it for anyone else. So I don't really care what other people think. They think it's weird. I'm like, well, I don't do it for you. You don't pay me. Right. Yeah. If you pay me, I'll do it for you. When did your opinion cut me a paycheck? You know what I'm saying? Exactly. Your opinion is not paying my mortgage. So right. Yeah. Or filling my soul bucket, Yep. I loved that. When we were talking in Portland, I thought it was really interesting hearing about your spiritual practice. And I was saying how, in our industry, I'm sure, there definitely are the people that are just like pure hard science, like knows in the textbook and, kind of tuned out from the rest. But it seems like a lot of people, and I know for me, I can only speak for myself at the end of the day, the deeper that I dig into the science and, the more it really does kind of push me into the spiritual realm. And I love everything you're saying because I was just writing about this the other day where we're programmed as soon as we're born, we get this kind of faulty belief system ingrained into our neuroplasticity to believe that we have to interpret all of the sensory input from this trippy reality. And we have to use our we only have these 5 limited worldly senses to interpret it. And then it kind of feels like hypocritical because there's a microwave right there that emits these microwave radiations that we know has an impact on the food to heat it up. We know microwaves impact our cellular biology. Can we see microwaves? Can we smell? Can we taste? Can we touch? Like, no. But so my point being, I feel like to think that there are not frequencies of energy that have a dramatic impact on our physiology, our well-being, it doesn't make sense to me. So this kind of stuff, we're very energetic, intuitive beings, so I think
spiritual practice, whatever that looks like. And that's the thing, I'm not trying to debate religion or spirituality. No, spiritual practice, I think, is essential for healing.
Right. Yeah, I totally agree. Works for me. So I'm going to keep it up.
Totally. Definitely. I might have to get some cards. I like how you're doing that, though. And, I was going to say, too, I was just talking to somebody about this, the kind of daily, like, affirmations of, like, I will work out today, or I do work out, every day, or whatever it is. Something I've been playing around with. I don't know if it's right or wrong, good or bad. It's all highly relative. But I've been playing around with posing the affirmation as, like, a question. So, instead of saying, like, I will be brave today, kind of asking myself in the mirror, like, how will I be brave today? So that way I'm trying to kind of trigger the brain to, like, get to work on solving that, problem, and thinking it through, like, how am I going to act? Well, gosh, actually, how am I going to do that today?
Well, and it also sort of sets the brain up for, like, you are brave. You already are. That's been established. But how are you going to show it, right? How will I be brave today? I am brave. How will I show it? So the brain's like, oh, I'm brave. Okay. How am I going to demonstrate this? Right. How, like, happiness, joyfulness, right? Like, how am I going to be joyful today? If you're not a joyful person, if you have a lot of anxiety or depression or what have you in your life, but if you say, I think that's excellent. If you say into the mirror, how will I be joyful today? It already sets the brain up for, I am joyful. I already am. So, but how am I going to demonstrate that today? And it's like, okay. Okay. And then it just sort of clicks and moves, right? We're just setting down that neuroplasticity of, I am joyful. How am I going to be joyful today? I am brave. How am I going to be brave, today? I am whatever it is. I am disciplined. I am organized. I am loving. I am open to receiving. How am I going to show that today? And then it just, like, the brain's like, oh, we already are that thing? Great. Okay. Sure. And neuroplasticity takes a long time to change. I tell people, if you've been telling yourself a mantra over and over again, if you identify with your thing and you say it out loud all the time, you belong to Facebook groups or what have you, different kind of groups where that's where you constantly identify with that thing, that is your reality. So I've had patients and people tell me they've left groups, they've unsubscribed from email things because they were like, I don't want that mantra being played over and over. I want a different reality for my brain.
Yes.
Right. So, and let's, like, the opposite, brave, scared, or, afraid, fear. You're very fear-based. So if you belong to a Facebook group or an email chain or newsletter that always talks about anxiety, like your anxiety, and you have anxiety and working with anxiety and anxiety, and you're like, and so it's just going to feed your brain, like, hey, you have anxiety, and let's lay down that pathway in your brain.
Right.
And I've had people go, I had to unsubscribe from all of that because I want to be happy, and I want to be joyful, and I want to be brave, and I want to be, all these other things. I don't want to have anxiety constantly thrown in my face because that's how I feel. Yeah,
exactly.
I love it.
Yeah, it's people. I think people don't realize their own power because we've been conditioned to believe that we're very limited beings with what we can do, but we have so much power, so much control. And I'm excited to have Dr. Nicole on because neuroplasticity is going to be the focal point of that conversation. I think that's that's one of the biggest things I love about our functional industry, whatever the hell we want to call it, is the gap in between, like, energy, spirituality, kind of woo-woo versus, like, hard, definitive science. It's getting really blurry, because we're seeing how it all is meshing together, and neuroplasticity of, it's like, we've historically thought of our brains as this kind of hard, non-malleable organ that, well, it is what it is, but now we're really learning, just like our muscles, right? We can train the muscle of, okay, if I train the bicep to be stronger through this contraction, okay, so if you're always thinking allowing yourself to go down these negative thought patterns and the story that you tell yourself over and over, like you're alluding to, you become that. Your physiology, your brain, your neural networks adapt to that. You're strengthening those pathways.
Right.
And so I just kind of, like, I know that's been a huge thing for my healing journey, is that spiritual journey. And, it's like, what's one of the best things you can do for improving your overall hormone balance? Probably like balancing your stress, your
Right.
psycho-emotional stress.
Yeah.
Spiritual practice is one of the best things we can do for that.
Absolutely. That and sleep, man.
Yeah.
People, we go back to that HRT conversation where, I'm sure people listening will be like, all right, Carrie's saying take HRT. I'm like, no.
Yeah.
I'm not saying everybody in the whole world needs HRT, but you got to work on the basics first. Again, it's not a quick pill that fixes everything. If you take estrogen, but your sleep is a mess and your diet is crap and you're unhappy in your life and you don't take care of yourself, like estrogen is not going to fix those things.
Mm-hmm.
It's just not. DHEA is not, testosterone's not, melatonin's not. I'm sorry. Like you still have to do the basics first.
Absolutely.
Every time. Mm-hmm.
Yep. It's always the fundamentals of, the lifestyle, the diet, rest, exercise, stress reduction, and, using supplementation, medication strategically, intelligently, and move that needle a little bit.
Yep, absolutely. And pet a dog, because when you pet a dog, you'll raise your oxytocin, or a cat.
Or what was at the FDN conference last year, put your hands like this.
Oh, yeah. When you go like this.
Yeah.
So when you do finger pads, if you put that in front of you, it'll automatically, it creates the circle. It connects the circuit. It connects the circuit, right? And so I had the whole group put all their finger pads together like they were thinking, and just sit with that for a minute. And it's amazing. I had so many people come up to me afterwards that go, oh my gosh, I did that. And I immediately felt myself drop down. I immediately felt myself not feel so stressed out or not feel so, whatever, hyped up about something. And it really makes a difference. I'm like, I know.
Yeah, it's huge. Yeah. I just did a recording the other day or last week, and it was all about Reiki, which
I love Reiki.
Do you like Reiki? Are you into Reiki?
Yeah. Big under it, yeah.
I figured you must be. I love all that stuff, but I have never studied. I didn't really know what Reiki was going into the conversation, but it was so cool talking about it, and just kind of, again, to some people they're gonna laugh and think it's dumb, but they're closed-minded. Because I think about, she was talking about, the energy, the power, the frequency kind of, we emit from our hands. Of, she said something about like, okay, if you hurt yourself, what's the immediate reaction? You put your hand on it, like, ow. And it's like, that healing power of touch. And so the circuit, and, there's just so much that we don't know. But I think sometimes with all the amazing technology we have, we're so smart, we know everything, and we kind of abandon things that we have intuitively known, and that's where like Chinese medicine can sometimes be really cool, is their style of medicine, a lot of chakras and chi flow and stuff like that, and it's not nearly the, our
Here, take this pill.
ELISA scan said, I don't know, it's just
No, it's true, it's very true, I agree.
It's huge. Well, I want to make sure I don't want to keep you all day, because your time's extremely valuable, but Dutch Fest.
Yes.
There's a Dutch Fest happening.
In October. So in Portland. So Dutch is having a conference, our first ever conference. We're very excited, and it's going to be obviously about the Dutch test, but it's going to be endocrinology based. FEST stands for Functional Endocrine Summit. FEST.
I love it. Yeah.
So it's our springboard for, we're revamping and growing our education. Right now, everything on our website, dutchtest.com, is free. All our videos, all our webinars, all our podcasts, everything is up there. And everyone, patient, practitioner, it doesn't matter, you can go watch it. And so we are revamping that and sort of bringing it next level for practitioners specifically. And we're going to start with Dutch Fest. So it'll be 2 days in Portland in October. You can get all of the information on the website. Yeah, and it should be nice weather, hopefully, in theory.
Yeah.
October in Portland. I hope
beautiful. When I was up there just last week or whenever that was.
You lucked out, because today is actually turning out to be quite nice. But yesterday and the day before, it was cold and it was rainy. It was like July-uary. So, which is
for sure
not uncommon. So if you move to the Northwest, be prepared for, July-uary. But we don't have humidity. Not really.
Yeah. So, I mean, I'm still going to somehow convince you to come to Kansas, because I have to take you to dinner and return the favor. And take you to the Country Club Plaza. So any KC peeps listening, taking Dr. Jones to the plaza when
I need to come to Kansas anyway. My husband's best friend lives in Kansas, and his oldest brother lives in Kansas. And so we talk about it all the time. Like, we need to go to Kansas. We need to go to Kansas. And
that's not something most people say. We need to go to Kansas.
When I say that, they're like, Kansas, really? I'm like, well, you know. And I adore his best friend and his brother too. So like, and they only live like, I think an hour apart from each other. So we need to go to Kansas.
It's, it could always be worse. It could be Missouri or Iowa.
Yeah. Well,
I won't pick on them.
I know. I used to live in St. Louis a long time ago, but
another life.
And I was a lot younger. Yeah.
Well, Dutch Fest, I'm gonna say right now, like, I have full intentions on being there, and I just,
Ralph's going. Peer pressure. Ralph's going.
Now I have to. I got to figure out the rest of my year, but then we'll hang out at the FDN conference, San Diego,
in November. In fact, I just made my hotel reservation for that. I have to make my plane reservation.
Hard Rock.
Yep.
Perfect.
I got a confirmation email today.
Perfect.
Yeah, that'll be fun.
Yeah, I'm super excited. I've got to go to Dutch Fest. Gives me another excuse to go to the Pacific Northwest, because I'm determined. I got to find, like, where do I want to live? You're showing me the quadrants on the map, so now I got to pick my
area.
Yeah, my area.
Right.
Yeah. Well, very cool. So Dutch Fest, check that out. You're revamping all of the education, but there's a ton of amazing free education that you put on the Precision Analytical website. And then, of course, your Instagram, which you're extremely active on. And it's just an absolute wealth of free information. I think it's just Dr. Carrie Jones. Is there an underscore in there? Or
there's a period. Dr. Carrie Jones. Yep.
Perfect.
Yep.
And we have all of your information. We'll be, posting it all over when we drop this episode out there. But certainly, you guys listening, the Hormone Queen herself. So be sure to check her out on Instagram. Follow her. Go check out the Precision Analytical. I think Metabolic Solutions will do like a little Dutch test and interpretation kind of promo thingy in honor of this convo, because it's just an extremely valuable, clinical tool that I feel like it's just a total game changer, within hormones and endocrinology, and being to navigate some of those more complex cases as you piece all together. But more than anything, though, like, love the hell out of you. You're the best.
Likewise. I'm so glad you had me on.
Yeah, thank you so much. I mean, your time is extremely valuable. You're an international speaker all over the place. So hanging out with me, both in Portland and on this podcast, like, it really does mean the world. And I know a lot of people are going to benefit from it.
Awesome. Oh, I love to hear that, for sure. Well, thanks again.
Yeah, absolutely. Thank you. And I'm sure we'll be talking again really soon, but I'll definitely have to make it out to Portland, and I will probably run into each other like at least one or two more times before the end. At least.
It's how it works, for sure.
Yeah. Well, enjoy the rest of your day. We'll talk to Dr. Ralph. We'll get him rescheduled, drag him on this podcast, and then we'll have a dude's version of this conversation.
Which will be fun, for sure.
Oh, absolutely. Absolutely. Awesome. Thank you, my friend.
All right.
You're the best.
Bye.
Love you. Bye.